Welcome back to Mountain Connections. We are checking with Intermountain Park City Hospital right now. We'll be speaking with Dr. Wing Province. He is the medical director at Park City Hospital. Dr. Province, thanks for joining us this morning.
My pleasure. Thank you.
So what is the mood at the hospital? We very much appreciate, more than anyone knows, how hard our healthcare workers are handling everything, how much they are working. What is the mood like at the hospital, and are you seeing a big increase in patients?
Questions. So far, we don't have a huge influx in patients in the inpatient part of the hospital. We've certainly seen a surge in the ER. And I'd say the overall mood of our nurses, our physicians, our technicians, everybody is upbeat. I think everyone, we are prepared. Our leadership has put the proper plans in place so that people need not fear. But I think what people are seeing in the media and what we're hearing from other countries definitely has us cautious. We're hoping for the best, but bracing for the worst.
Well, it's good to hear that the mood is up, that everyone is in good spirits for the most part, and that the patient load is, you're able to handle it as of right now. That is definitely good news. Now, Intermountain announced this week that they will be posting certain elective procedures. What was the decision behind that, and how has that helped open up staff to hopefully take their energies and put it towards an increase in patient load?
Yeah, it's a great question. It wasn't one that was a decision that was made easily, but after a consultation with the most senior leaders and physicians that we have at Intermountain Healthcare, they made the decision based on a few principles. Number one, we'd like to keep the public healthy, and if there's folks that are coming in for non-emergency type surgeries, and with the potential of them being exposed to the COVID-19 virus, the idea is to keep the healthy out of the hospital. Secondly, if patients coming in from the community are infected, we are hoping to keep our staff healthy and protected from contracting the disease so that we are here to serve the community. But then there's also an issue of resources. So every time a patient gets surgery, there's a lot of equipment and other resources that go into it. For example, ventilators, hospital beds, not to mention all the gowns, the goggles, the masks that go into that. So the idea is if we can reduce the utilization of all those resources and have them available for when patients are coming to our facilities with the COVID-19, we have all the resources necessary to manage that influx of patients. I'd say lastly, we're finding that if a patient had the COVID-19 virus, but they weren't aware, and they go into surgery, the stress of not only the surgery, but then manifesting the virus later can sometimes lead to higher complication and potentially even mortality rates. So all in all, the intent was to look out for our community, to do what's best for our patients as well as for our caregivers.
You mentioned that part of the reason behind that decision was to make sure that there's enough ventilators available. We've been hearing reports across the country of hospitals and medical places not having enough supplies. Do you feel like Park City Hospital is prepared with enough ventilators, masks, everything that medical professionals need to treat any patients that might have COVID-19?
It's a great question. Right now, we do feel like we have adequate supplies and ventilators, particularly for our size community. We're a relatively small hospital, but we do a lot of surgeries here, and as a result of that, we do have quite a few ventilators. And importantly, we have physicians and nurses, respiratory therapists, and all that we would need to manage those kinds of patients here for our community. And then as far as the other personal protective equipment, everything we hear and everything that we're seeing is that we have enough for everyone to feel that we can take care of an influx of patients at this time.
And Intermountain also announced an expansion of their telehealth services. How has that impacted your patients here in Park City?
Great question. Right now in the emergency department, in fact, as of last night, I just worked the overnight shift and was able to see the equipment. We have the capability of a physician sitting at a desk through telehealth, through a camera on one end and a camera on the other end, evaluate a patient in a room, being able to ask all the same questions, but without having to use all the masks, goggles, gowns, and all that equipment, and getting a good assessment, determining what the patient needs, being able to evaluate them by their vital signs and determine what the course of action is. So it keeps our caregivers healthy, it protects our resources just in the emergency department. Now similarly, we have the opportunity to use our telehealth to consult ICU physicians in the event that we were to have a flood of patients come in and we needed critical care consultants from around the system. We have that available. We haven't had to use it yet. Fortunately, we have not had any critically ill COVID-19 patients, but we have that resource available if we do need it.
And one last question for you, Dr. Province. I definitely don't want to take up more time of yours than we absolutely need to. But I'm wondering, as the general public, if you're feeling sick, if you have a loved one or a family member that's feeling ill, there's a lot to think about before you head into your doctor's office or to the hospital. There's definitely a wide range of symptoms. We've heard definitely fever, respiratory symptoms, but then there's other symptoms that, maybe vomiting, maybe runny nose. It's really hard to know when you should see a medical professional, but you also don't want to expose other people, and then you might not get tested. There's a lot to balance. Do you have any advice for that?
That's a great question. And I think the three main symptoms that folks at home need to be aware of are fever or cough or shortness of breath. Those three seem to really be typical to the COVID-19 virus. And if they're wondering if they should be evaluated, if they have any of those three symptoms, those are risk factors. And then there's epidemiologic risk factors, or, for example, traveling outside the country or even within the country really over the last 14 days, or having been exposed to somebody who is COVID-19 positive. Any one of those symptoms paired with one of those features would certainly warrant testing. And in fact, what we've created here in Park City, in conjunction with the medical group, the Intermountain Medical Group, there is a screening drive-through that you can go to at the ice skating rink just close to the hospital campus, where folks can go. They can be screened by a medical professional there, and that professional, after that screening, will determine if they need to be tested. And for those who qualify for testing based on some of the criteria that I explained, and if the folks at home don't remember those off the top of their head, that's okay. The folks there will have a certain procedure that they use to determine who can be tested. They'll obtain a sample and they'll send it down to our central lab with the hope of having those results to you within the next 2 or 3 days.
Well, thanks so much, Dr. Province, for joining us today. It's good to hear that Park City Hospital is generally handling things well, is prepared, and that you are ready for patients and really understanding of what's happening right now. So thanks for your time.
Thank you.
All right, again, thanks to Dr. Wing Province and to Intermountain Park City Hospital for arranging this interview. We have more coming up right after this. Stay tuned. We'll be right back.